To see a downward trend in our COVID hospitalizations, but this is no time to become complacent. We still have a lot of people in the hospital with COVID. Today we have 287 patients with COVID, and although we're seeing those numbers go down on a weekly basis, we're still admitting hundreds. Last week we admitted 202 COVID patients, and in that same week, 46 patients lost their lives due to COVID in our hospital, including 6 yesterday. So this pandemic is still there. It's still out there. And I think it's very important that we not look at these as numbers. These are people. These are mothers and fathers and daughters and sons. And each one of them has a family that loves them and grieves their loss as we do. And we need to always remember that. In addition, the patients that we do have in the hospital, there's still some that are very sick. We have 80 patients in the ICUs and 52 that are on ventilators. Our capacity is at 92% hospital-wide, and our ICUs are at 94% capacity. In addition, at Golisano Children's Hospital, we have 11 children with COVID in the hospital, and 3 of them are on ventilators. Are in the ICU. So I want to make sure that we continue to do everything we can to slow the spread of this virus. Get vaccinated if you can, wear masks, social distance, all the things that we've been talking about. Today we're going to focus on something a little bit different, and that's long-haul symptoms of COVID. We know that studies have shown that 27 to 33% of patients continue to have symptoms after 4 weeks from COVID, and they're considered long-haul. And what's interesting is it doesn't seem to be related to the severity of disease. You could have relatively mild disease and wind up with long-haul symptoms. So we're going to talk a little bit about that today. So at this point, I'd like to introduce Dr. Jordan Taillon, who will talk a little bit more about that. He's a specialist in critical care medicine and pulmonology. Dr. Taillon?
Good afternoon. My name is Jordan Taillon, and I'm one of the pulmonary and critical care physicians with Lee Health. On the front lines in the ICU, and also as a pulmonologist with a large outpatient practice, I've gotten to see the whole spectrum of the COVID-19 pandemic, and both the acute and the long-term and lasting effects on the staff and also on the patients we have treated. So I know I've spoken before to the stress and strain that has been put on our staff, but I always think it needs mentioning. Our nurses, respiratory therapists, techs, housekeepers, physicians, and practitioners have worked longer hours, extra shifts, been taken away from their families, under extreme conditions, and have truly shown a strength and resiliency that can really only shine through during times of duress like this pandemic. I think they all deserve recognition and a thanks for a job well done. Having the perspective of seeing patients with COVID in the hospital and then having them follow in my outpatient practice has allowed me not to see just what this does in the ICU, but also to really see how it can affect people long term after they have been discharged home and are continuing their recovery journey. This is not necessarily one of these diseases where you get it and start recovering, you feel weak, fatigued, maybe have a cough, some muscle aches for 7 to 14 days, and then you feel back to yourself. Quite often, symptoms continue for months and even up to a year. The scary part is that the second wave has not only affected the elderly and the immunocompromised, but have been seen in many young and even healthy people. I have intubated and put on mechanical ventilation people in their 20s, 30s, and every decade above that. Many of these younger people that have been intubated are not on medications, they are not obese, and they really don't have any other medical issues. The thing that haunts me is the fear they have in the moment when they're going on mechanical ventilation, and also sometimes the confusion. Many ask, how did this happen? I never thought this could happen to me. I didn't understand how serious COVID was, and will I die? When patients come into the hospital, it is nearly impossible to figure out who will get better and who will get worse. 2 patients could be in rooms right next to each other on the same level of oxygen, same age, have the same inflammatory markers, and go completely different ways. One could be discharged home within a few days and start feeling better, and the other could end up in the ICU on mechanical ventilation and possibly pass. There really is often no way to tell. For those who are able to leave the hospital, oftentimes the recovery journey is just beginning. It is very common for people after being discharged home to have severe fatigue, shortness of breath, chest pain, and tightness, and a chronic cough. less common but still very present, is dizziness, insomnia, headaches, joint pain, and upper airway congestion. The physical effects are really only half of the battle, as there can also be severe psychological effects present. Many people will suffer from PTSD, memory problems, and severe anxiety, which can even be debilitating. A retrospective study looked at 1,300 people who were discharged home after having COVID-19. Of those 1,300 people, only 40% were completely independent at 30 days with their activities of daily living. So just let that sink in for 1 second. That means 60% of the people who had left the hospital and been discharged were still not able to fully function at 30 days. And that's not counting the many thousands of people who have not left the hospitals. Another study showed that most patients discharged from the hospital had significant symptoms for at least 2 months, and oftentimes for up to a year. These are significant physical and psychological effects on people who get COVID-19. I hope this sheds some light on the very real, long-lasting physical and psychological effects of COVID-19. And the best weapon that we have in this battle is prevention, and prevention is the vaccine. So I'd now like to introduce Nicole Shimko, recovered COVID-19 patient and supervisor for the critical care transport team at Golisano Children's Hospital. Thank you.
Hello everyone, good afternoon. I am Nikki Shimko, and I come to you today not as a nurse. I come to you as a patient, as a neighbor, as a friend, to kind of tell you a little bit about my journey with COVID. It was about a little over a year ago. I contracted COVID, community acquired, and really wasn't expecting the long haul that I had ahead of me. For those of you who may or may not know me, I'm a very active mom in the community. I have 3 girls. I am healthy. While I do have controlled asthma, I'm not on medications to that. I knew I had a little bit of a risk just knowing that I had allergies, but nothing to the extent that I had. My first 2 weeks I spent in bed, sick, and then the next 2 weeks I spent trying to get out of bed and choosing between making breakfast, doing laundry, doing the dishes, trying to do some kind of function to get back into life as we could. I wasn't prepared for some of the mental aspects of it that I faced as well. The who did I expose, who may die because I've exposed them now. All of those fears that came in with it, and then, being secluded from your family and your girls and your husband wasn't easy. After I was cleared to come back to work, I couldn't walk the hallways without being out of breath. I couldn't walk to my car without being completely short of breath. And at this point in time, I had been on medications. We've added more medications. And the whole thing really took 9 months for me to get back to not being on any medications for cough and shortness of breath. I think with all of this, that was the whole reason why I chose to get vaccinated. I couldn't put myself through that. I couldn't put my family through it again. I needed to be able to prevent what I could because it wasn't fun. Quite honestly, my mom may kill me for saying this, but it sucked. And I just hope, I am one of the lucky ones. I was in the ER for a visit, but I was never admitted. I didn't have to be admitted. But even then, being healthy and active, I still took 9 months to recover. So I just hope this helps put a little perspective for everybody, that it's not just those who we don't think it's going to happen to, because it happens to us. And after that, thank you very much.
Thank you. Great job. Thank you. All right, we'll be happy to take any questions you might have for any of us. Yeah.
And what's the current status of the emergency department and available beds or wait times?
Well, obviously, with our volumes being lower, we're seeing lower wait times in our ED. I don't have the specific number for you right now, but clearly our volumes are lower than they have been. Our inpatient volumes are lower, so it's a better situation in the ED than it was. Yeah.
Hey, could you talk to? I said I'd move a little closer. Could you talk to the children in Golisano? I think you said 11 and 3 on ventilators. We're continuing to see
3 in the ICU.
3 in the ICU.
Yeah.
Can you talk about how we see pediatric cases still high, even as the numbers overall start to drop?
Well, you know, we've seen numbers in the Children's Hospital ranging from, let's say, 7 to 17 over the past few weeks. It sort of goes up and down every day. So there hasn't been a consistent upward trend, downward trend. It's very irregular.
Why would that be? That stays as the overall numbers drop?
Well, I think that there's, you know, children are getting together more. They're being in school. So I think there's more likelihood that you're going to see spread, and children don't get vaccinated, you know, under 12. So I think if you take those two things into account, you're going to see more cases in children.
I know Pfizer's released some new data that looks promising for
Right.
getting younger kids vaccinated. Do you think that could help reduce some of the numbers in pediatric cases?
Well, yeah, certainly if the FDA does approve the vaccination for children, the data has shown it to be effective in preventing serious illness. So we would anticipate that those numbers and those hospitalizations would go down if a significant portion of the children were vaccinated.
Are we now past the point where we would see a Labor Day spike?
Most likely. I think that if we were going to see a Labor Day spike, we would have seen it by now.
And so moving forward, you know, are we out of the woods yet? I know you want community members not to get complacent
Right.
yet, but I guess what would you say the biggest message you're still stressing is?
Well, I think, you know, as I said, we still have close to 300 people in the hospital. We still have a lot of people that are sick. We always run the risk of another variant coming along. So we will keep our fingers crossed. You know, this has been the fourth surge we've seen, and we certainly don't want to see a fifth. But it appears that this surge is definitely on a downward trend. All right, thank you all again for being here. Appreciate it.